This is Average Joe PT, where we're here to reduce pain, reduce anxiety, and improve function. And today, with me and good old Scully here, oh yeah, me and Scully, we're going to talk about reverse total shoulder replacement versus total shoulder replacement. What the heck's the difference? Huh, Scully? What do you think's the difference? Well, we'll see what Scully has to say a little bit later, but today we're going to talk about what happens when the doctor says you need a reverse total shoulder replacement or total shoulder replacement. Stay tuned. All right, Scully, what do you think about the total shoulder replacement? Are we ready to rock this thing? Let's hear what Scully has to offer.
All right, boys, here we go.
Okay, here we go then. All right, when the doctor comes up and says to you, all right, guess what? I can't repair your shoulder. I can't fix the tendons. They're too badly damaged. You need to have a total shoulder replacement. And you're like, what? What the heck? Or reverse. Now, the difference between the two is this. I'm going to bring you up real close now. Boom, 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 boom. All right. So, if we look at the shoulder, the ball, and the socket, right back here, this is the socket, this is the ball. Now, let's say you've broken it, you fell on it, or the rotator cuff muscles. I'm going to leave a tab up on top here that goes over the rotator cuff muscles, those sit muscles, and what the heck's that even mean? If you just look up here and click on that, you can find out some further information. But now when we talk about, let's talk about that reverse shoulder replacement. They switch the socket with the ball, which is the head. And so what that means is when they go and replace this hardware, they actually make the ball where the socket is and the socket where the ball is. So let's pretend this is the ball now, and now this is the socket. And that's what that reverse total shoulder replacement is. Now, you're not going to get the same exact movement versus a total shoulder replacement. A total shoulder replacement, essentially they replace the ball and they replace the socket. What they end up doing is just like they do with either a hip or knee. They literally cut the neck off of here. They take that ball out, they drill down into the shaft, and they put a new head and neck on there, and then they put a new socket plate on there, so now you have a new ball and socket. Let's say that you had really bad arthritis, or like I said before, the rotator cuff is just torn or just can't be fixed, or you've fallen broken on it, or for some reason the blood flow to the bone has been lost from a fracture or something like that. That's what they'll do with a total shoulder replacement versus a reverse total shoulder replacement. Now, if that wasn't enough tongue twister, I don't know what is. Hey, Scully, what do you think about this, Scully? Huh? I don't know myself. But what do you say?
You've explained enough already. Let's get on with it.
Seriously? All right, I'm gonna get to some exercises in a few minutes. You just hold off a second. I gotta explain to them enough. I gotta explain to you guys enough so you actually know what the heck's going on here, just versus just throwing a bunch of exercises out there. And so after that's done, you're gonna have a protocol that you're gonna have to do. Now leave some comments down below if you want to, and we can kind of discuss why they're doing those protocols in that certain way. What you can expect from your first few visits in a physical therapy clinic after having either one of those surgeries, whether it's a total shoulder replacement or the reverse total shoulder replacement. The difference between the two, depending on what is left from the actual tendons that you probably tore up in there. Like I talked to you about before, there's 4 tendons that make up that rotator cuff. Now, let's say you have 3 of the 4 rotator cuffs that are functioning. They ain't ripped off the bone for whatever reason. You're probably going to have pretty good motion after everything is all healed up. But let's say there's 3 out of the 4 rotator cuff tendons are actually not attached anymore. You can expect that you're not going to get the same motion on the other non-injured side as you would on the surgical side. You got to expect some of that. Right, Scully? I mean, you're not going to get it all back. I don't care how good your therapist is.
There's some really
Yeah.
good therapists out there.
Okay, all right. You're probably right. There's some really good therapists out there, and but let me tell you, when some of the rotator cuffs aren't attached right, you're not going to get all your motion back. Now, there is one huge group of muscles called the deltoid muscles. Boom, I'm going to leave a stick right there for you. All right, those muscles can compensate a little bit of loss of rotator cuff, and so when we go in the next section of what exercises you're going to do right after surgery, probably somewhere around that 6-7 week mark after having the surgery, the physical therapist should start to target those deltoid muscles if your rotator cuff or some of those muscles of the rotator cuff just don't exist anymore because they're just not ripped, they're just not attached to the bone anymore. And so let's go ahead. I'm going to show you those few exercises. You want to get down on the floor with me, Scully, like we normally do, and show you the exercises?
No way!
And then how the heck am I going to show them the exercises if we don't get down on the floor? You got to be kidding me. I'm going to have to do it. He doesn't want to, but I have to do it. I have to show you what you can expect. We'll be right back. Okay, Scully, fine, we won't do it on the floor. All right, so apparently Scully doesn't want to do these exercises on the floor, so I'm going to do them in a chair, and you can also do them in a chair too at home. So you get home from the hospital. These are the 3 exercises you can do at home, as well as obviously they're giving you that giant ice machine that you're going to use all the time. Tip number 1, recliner chair. Sleep in a recliner chair at least for the first week or 2. You'll thank me, you'll actually get some sleep. There's no way you're going to lay down flat in the bed after having that kind of surgery, whether it's the total shoulder or the reverse total shoulder replacement. You're just not going to be able to tolerate it much until that thing heals up a lot. So that's tip number 1. Tip number 2, besides obviously icing it, because that's like a no-duh, is I want you to sit up and pinch your shoulder blades together. You'll be able to pinch your shoulder blades together with that abductor wedge even on. That way you at least keep your shoulder blade muscles engaged. Remember how I showed you in the past? So if any other link you want to look at my other shoulder, I got a playlist. I'm just going to hit it up here in the playlist for the shoulder. I go over the shoulder blade and the foundation of your entire ball and socket, elbow, wrist, and hand. If you ain't got a good shoulder blade, the rest of this is not going to function correctly. So number 1 is basically shoulder blade. Hold for maybe 5 to 10 seconds, pinching those shoulder blades together, and then come back and relax. And repeat that maybe 15, 20 times, at least 2 or 3 times a day. All right, so that's basically tip number 2 or 3 if you're counting. I lose count after a while. What about you, Scully? Does that sound pretty good so far?
I guess so.
Okay, all right. He says it's okay as long as he's not on the floor. He's all worried about not being on the floor. Well, he's going to be surprised at some point we're going to have to do exercises. Maybe not this video, but doing some exercises either on the bed or on the floor or on the couch. But that's for another time. All right, the last exercise I'm going to give you is called the pendulums. Now, to do this correctly, this is how you have to think about it. Think, think, think. Going to get you into a standing position. I'll be kneeling just because I want to stay in the view of the camera. But when you're doing this, I'm going to give you a little side view. You don't want to be like this doing it. You want to be over the top and letting your shoulder dangle. So coming on over the top and letting that shoulder dangle, and you're bending your knees, relaxing the entire shoulder, and just letting the weight of your arm be like this. You're not actively moving the arm. You're not. This has just had major surgery on it. You're not actively moving those muscles at all. You're just kind of relaxing it and going around, bending the knees, letting your body move the arm, not letting your arm move the body. All right, so that's huge tip number 3 that I see all the time done wrong after the doctors, quote unquote, is showing them what to do, and then they come to me and they're not doing them correctly. So that can also increase your pain too if you're not doing the exercises correctly. So we have icing, we have shoulder blade squeezes, we have pendulum exercises. Last but not least, I'm going to leave a tip up here also that goes over some types of massage that you can do. Now, I did it underneath a postural one, but it's a ball, or what we call a theracane. If you look at that view, that tab, excuse me, that'll give you some ideas. Right, Scully? He's not talking right now. He's mad at me. He shouldn't be. I didn't have him on the floor. But that'll give you some ideas, some massage techniques that you can do in regards to having maybe some pain along your shoulder blade area that runs to the neck. So you can look underneath my postural massage one. That'll give you some idea. So, like I always say, leave some comments down below. Love to hear from you. If you're a new person, I'd love to have you subscribe. Hit the call bell so you can see my next video and what I'm going to talk about. But until next time, I want you to look up and keep smiling.
Look up and keep smiling. Seriously?
Yeah.
Fine.
Don't you like that?